You've got to be constantly evaluating whether we're speaking to somebody, like thinking like you're speaking to that person on the outside, constantly thinking, am I really talking to a clinician out there who's taking care of this patient, seeing this problem, or am I blowing it over? Am I saying like, I don't know, consider clinical correlation. Maybe it's red, maybe it's this papular, maybe it's whatever. It depends, that kind of stuff. And always sort of think about that you're talking to this person and you're being respectful to that person. Are you respecting their time? Are you respecting their ability to learn? Are you respecting that this is a hard topic? Are you respecting that they're bored? Are you respecting that this is an impossible thing to ingest and memorize? And I think that that's what we do that's different, is to constantly think about really who you're talking to. Not am I doing a good lecture, not am I doing my slides good enough, but am I really helping that person on the other side directly, which I think is what you were talking about is a important piece of it. Having other people in the room and actually talking. So when we're in the peanut gallery and you're talking back and forth, somebody says something that I don't understand, that means somebody else doesn't understand it. So then we go back and forth and ask questions.